Good day, welcome or welcome back to my YouTube channel. My name is Ronelle. I'm a psychologist and I make YouTube videos about the broad concepts of psychology and where I also draw upon my faith, my love for films, and different aspects of popular culture. I'm not alone, usually on my channel, and I have a guest who will be here for most of the time. I'll let her introduce herself.
Hi everyone, welcome to the channel, Tourette's channel. I'm Ronelle, also a psychologist, counseling psychologist, been practicing for about 6-7 years. Yeah, and hopefully I'll be able to make it most of the time on Rita's channel.
Okay, yeah, thanks Ronelle, thanks for joining us today. So what it is then, I just want to spend this first video really is introducing ourselves and getting to the basics regarding psychology, and then giving a vision of what it is that we want to hopefully achieve with this channel. We really want it to be helpful and useful and definitely fun and real and authentic, right? So I think the first thing is perhaps to introduce ourselves, and Ronelle has done that. She's gone into a bit of depth. So I'm also a counseling psychologist, and I also have been working, I think, for the same amount of time, similar. Ronelle, as far as our personal history, how would you describe us? Like, what are we?
Well, I mean, we are basically friends. We've been friends for a long time. You could probably say we're colleagues and friends as well, because we've studied at the same university for I think from first year. Yeah, from first year throughout the undergrad. So I don't know if everybody knows on the channel, but basically psychology is a long road. Sorry, Rita, for overtaking you. I'm just going to say whatever comes to my mind. But basically, yeah, psychology is a long road. We did undergrad together. So that's basically your first degree. Or junior degree, I think some people call it. And then you have to do an honors degree. Depending on the university you go to, some universities do honors for 1 year, some do it for 2 years. Our university did it for 1 year. Rita went to another university in honors, I think.
Yeah, for honors.
For honors, he went to a different university, and then he came back to the same university that we had both studied at, and then we did masters, which was 1 year. And interestingly enough, we also did our internship together at the same place.
Yeah.
At the same site. Yeah.
We have been joined at the hip. Yeah.
It's like we twins. Yeah, so same internship. So we basically, it's like we should be called doctors as well, because that's 6 years already, 6 years in.
You know, that's a whole other topic of conversation, just regarding how psychologists feel in their relationship with the health doctors. But anyway,
doctors study for 6 years. We also study for 6 years. So basically with counseling psychology, we don't have to do the second part, which is the community internship, because the clinical psychologists do two internships.
Let's take it a step back. You're getting a bit ahead of ourselves, okay? Take a pause. What Ronelle is saying is important and it's true, but we need to get there first, all right? Let's just start off at the basics, okay? We are psychologists, right? Let's start off with what is psychology? And I'm gonna start off by asking Google. We'll see what Google has to say about what psychology is.
Let's hear what Google's saying. It's quite interesting.
All right, psychology, a scientific study of the human mind and its functions, especially those affecting behavior in a given context. So synonyms are study of the mind, science of the mind, science of the personality, study of the mental processes. That's what Google has to say.
Very, very basic, but okay.
But that's where we are, we study the mind. That's what psychology is.
But I mean, I think also when we say we study the mind, that's so vague, because a lot of people are even confused. What are we saying when we're saying mind? And then there's a whole argument about what the mind is. But I think for me, it makes more sense when you look at the different branches, because we study human behavior. We study why people think the way they think. why they behave the way that they behave. You know, so with that comes so many branches of psychology. We've got people's behavior in the workplace, that's industrial psychology. We've got mental disorders, you know, when people start, you know, having abnormal behavior, you know, so it's not just normal behavior, it's abnormal behavior. So then we go into psychopathology, which is like mental illnesses, you know, you can go into the clinical sphere, so clinical psychology, because they're more very much into the mental disorders. And then we're also looking at just the struggle that people are having to adapt. And that's where we come in, because we're mainly dealing with those people that are just having your normal day-to-day struggles and they kind of fall apart. So counseling psychology is more that adaptive struggles of human behavior, you know, and how childhood trauma has affected people and how they just, you know, what kind of relational patterns they've had, attachment patterns, all of those things. So again, if you're just thinking about all I've said, then we're also looking at neuropsychology, you know, we're trying to figure out the origins of these mental illnesses. There's so much. That's why I said, I feel like when you just say it's study of the mind, it sounds so vague. And then when you have to go into it, it's such a broad field and it's so interesting that I just feel like it makes it sound too boring, you know. But again, I guess we do need a very simple explanation, otherwise it becomes too long for Google.
And it becomes too much to actually process, right? So if I'm having an introduction kind of conversation with someone, asking like, what is psychology? I think that's a good place to start. Each one of those words is its own universe. You know, talking about personality, universe, mind, universe. It's just like, we're not there yet. We just want to, this is psychology. Okay. We'll inch forward into the different areas and so on. We'll see how it goes. And this also brings me to the value of commenting or asking questions. I think that's very valuable because we would like to actually talk about things that matter to you as well, questions that you might have as well. And we can store that up and we can get to it as far as making it topics of conversation.
Definitely.
Sure. So that's what Google has to say about what psychology is. And I think we can agree, again, at the basic level. Are we agreeing with each other? Okay.
Yeah, I mean, very basic, but okay. Yeah, I agree.
Yeah. Okay. All right. And we'll get there. It gets a lot more complicated. So, okay. So if that's what psychology is, that helps as a start, right? So then what is a psychologist? You know, what is a psychologist? What does Google have to say about that? Let's see. Google, what is a psychologist? What is Google about? What is an expert or specialist in psychology?
Thank you, Google. That was so helpful.
What's another one?
It all.
A person who specializes in the study of mind and behavior or in the treatment of mental, emotional, and behavioral disorders. Specialist in psychology.
That sounds better. Thank you.
That's
more helpful.
Much better. Thank you. And I think it's a helpful definition. I think it encapsulates those 2 points, right? If psychology is about the study of mind, emotions, behavior, and we can get into each area of that in a lot of depth. A psychologist is someone who studies that and practices it and specializes in it, right? In terms of understanding how people's minds work, how their personality works, how their emotions work, and of course, helping people to navigate times in their life where they would be struggling or experiencing challenges in those different areas of life, right?
Interestingly enough, and I mean, this is a side comment, my mind tends to go off in little tangents, so just please forgive.
So this will happen. Same thing with me, and we're gonna learn about my little how my mind works as we go. Continue.
So with me, interestingly enough, when I think of the work that I do, a lot of the time I think of myself as a healer, because, you know, if I take it back to my own identity as a Black person, my own identity as a Christian, this is just my own religion that I identify with. But if you look culturally, what are people used to? You know, in Black culture, if there's issues in the household, something's going wrong with the family, there's a child who's sick or who's acting out or something odd, for Black people, that always goes back to the ancestors. And then a sangoma, a traditional healer, has to be called in, or an inyanga, depending, or umtandazi, which is like a prayer warrior or something like that, depending on, you know, the specialization. But again, if you think about it, as Black people, we always feel that we need a healer to come and help us, you know, and whether that's person who's going to mediate with us, with our ancestors, a person who's going to come and mediate with God, whether a ceremony needs to happen to cleanse the household or to correct some kind of something that happened in the history in the past, then again, all of these people are healers. And then if you had to translate that into the Western world, what are we doing as a psychologist? We're helping you heal emotionally from whatever mental wound or whatever trauma, whatever, you know, something happened or if something incorrect happened somewhere, and we're trying to correct either the behavior or the mental attitude or whatever it is. But it's all healing work. So in my mind, I think of myself as the modern healer. So I think for me, that's more helpful when I speak to people who are not familiar with the word psychology, because I think it's way easier to kind of consume because there's a history and a background that you already have to make that association. Oh, Rita, you're frozen. I think there's an issue with your network.
I definitely agree. And I feel,
okay, I think you're back.
Yeah, I can hear you just fine.
Oh,
You're the one who's frozen. Now
oh, is it maybe it's my network? Sorry, I'm not sure. Okay.
Yeah.
Okay, you can continue. You're saying you agree?
Okay, are we good?
Mm-hmm.
Yeah, I agree. That it's about being able to help people heal from the challenges that they have, or to help them to solve problems about things that are happening in their life that they want to be different. But I also think an important part of it is it isn't just about writing or improving things that have gone wrong. I think it's about helping people to figure out what makes them healthy, and helping them to become more like that kind of a person. So in terms of, I don't know, whatever it is, how they communicate, how they process emotion, how they relate to other people, how they relate to themselves, helping them to become healthy, develop the habits of what it means to be emotionally, mentally, relationally healthy, and then staying there, right?
Yeah.
And then if things go wrong, helping them with the skills and the tools to recognize when things aren't just down or bad in life, because that happens. But when things are becoming so bad with themselves and so unhealthy that it's really, it's messing with different areas of their lives in a way that's recognizable, that's also when we step in and try to help a person.
Normally that's when people ask for help, is when things go wrong, because they wait until things go wrong. It's like, oh my gosh, I'm failing, or I can't make it to work anymore. Something is definitely wrong. So and then they come for help.
And for me, that, you know, like what it is you just brought up right now, I think is one of the ideas that I would like to cover as well, about the reasons for why people would look for therapy and the timing. Because in my experience, that is such a huge thing for people to have an understanding of by the time they meet with me. And we'll talk about what brings you over here, but the timing is important. That's a whole other conversation. We'll get there. So
there's just too much to say.
There's too much to say. There's too much to say. So one, psychology. Kind of, we've given a nice Google kind of definition and understanding. What a psychologist does. I think we've talked about that very briefly. I'm interested in our reasons, though, right? You've given some clues for you. You talked about yourself as a healer. I'll talk about myself as well. But why did we choose this path? Why did we choose this life? And I say that kind of joking, but also being real. Like, we spend our lives, I like to describe psychologists when I talk to my clients. I say psychologists first and above everything else. We are professional secret keepers.
Yes,
we keep secrets for a living.
Yeah.
And that's a very important part of it. Yeah. And again,
it's like
that's
a bank. They keep your money, but we keep your secrets. That should be our new slogan.
The bank keeps your money. We keep your secrets.
Secrets. How can we help you? Oh my gosh.
That's so good. You should write that down, man. That's what I like to do. Yeah, I like to write these things down. Another conversation. Anyway, what you just brought up is the issue of confidentiality. But again, we're going to have to park that. We'll park that. We'll get back to it. So I was saying, it's important for us to understand why we chose this life, because I think later on in other conversations, we'll talk about how it affects us. We hear and we speak about things that are very difficult in people's lives, and we also help them to heal. So what I'm asking now is like, why? Why did we choose to do this? What about you?
I think for me, I mean, I think a lot of us go into jobs according to our abilities and our skills. And of course, if you're a person who believes in destiny and vocation and all of these kind of things, then it all comes together. But for me, I've always been a good listener from childhood. I've always been an introvert, and I just have never been a person who likes noise. I mean, I was very talkative. At first, my mom says that I wasn't that talkative. She was a bit worried, like, can this child talk? What's going on? And then suddenly she realized I was making full sentences. She was like, what? She can talk? Wow. But yeah, I think I've always been a good listener. So how that presented itself is that a lot of my mom's siblings would just talk to me, and I think they would forget that I'm a child, and they would start just offloading like their secrets and their problems, and and then I realized, wait a minute, this is
these
valuable.
Are your aunties talking to you.
These are my aunts and uncles, like they just would just talk to me like I'm their equal, and that made me feel so powerful. I was like, I'm doing something good. I'm doing and you could see like it was healing, because for a person who's on the outside, you just have so much clarity. And being a person who would listen, I would just get to the heart of the matter and say, I think you should do this. I think this is the issue. And they were like, oh yeah, that was so simple, and it was like, oh, I've got power. I'm doing something profound. I should do this as a career. Like, I'm made to do this. Like 8, somewhere there, 8, 9, 10,
wait.
around there.
So they are having this conversation with you, and you're 8, 9, and 10.
Yeah.
Whoa. That, I don't want to imagine what you were hearing.
I think also, I mean, culturally, you must remember what kind of background I come from, a colored family where sometimes boundaries are not very good. There's some issues with boundaries. So yeah.
Okay. I mean, my journey, I think, is different from yours. Because so like, maybe ask this, how old were you perhaps when
Yeah,
you
so
decided
I
or
think,
realized that?
I don't know when the word psychology came. I don't know who presented it to me. I don't know if it came from seeing Marlena on Days of Our Lives, the work that she was doing. I'm like, wait a minute, that's a little bit of what I do here in this family, you know, and I would like to help other people. And so that word started presenting itself very early. By the time I was in high school, I already knew I want to do psychology. I've always known it because I felt like that was a talent that I had, and that was also something valuable that I could give back. So it always, you know, that altruistic nature in me. I want to help people. How can I help? I don't like blood. A lot of my family tried to encourage me to do health science. My dad was determined. He was like, you must do medicine. You must be a doctor. I think that was always his dream. He was like, you know, since I couldn't be a doctor, my daughter must be a doctor. And I was like, no, me and blood, no, we are not friends. You know, so yeah, but I always knew I wanted to help. I wanted to heal. That's why I said, for me in my head, I'm still healing people, but just mentally, not physically.
Yeah. I mean, that's an interesting, for me, let's say you compare that
yeah, I feel like for you, you came at a completely different angle. Yeah.
Absolutely. So if you don't know, I never planned on becoming a psychologist as a career. I never did. My first love, like I said, are films. So my vision, my dream was to be a creative, specifically with films, but also being an author as well, nonfiction, right? No, fiction, right? And so that was the vision that I had for my life. That's what it is that I wanted. But at the same time, I'm glad
actually,
that I was
sidebar, interestingly enough, that was the main thing I think that made us friends, was our love of books and fiction and that kind of creative world. But anyway, carry on.
Yeah, absolutely. Yeah, you are correct. So yeah, so that's what it is that I wanted to do. But I was also very concerned about what a career in that might look like. You know, I mean, I'm all for being creative and I'm all for building a career in that, but it isn't the path to becoming stable and self-sustaining and ideally successful is a lot less stable than the path to becoming a professional, you know. And so I won't lie, I was a scaredy cat. I was so scared to actually just take that risk, right? And also, I mean, thankfully, my dad wasn't against it. He was very uncomfortable. Uncomfortable enough.
I must say, you know, most parents are not happy with their kids doing an arts degree, any kind of art grade, because it's such an unstable career field that it raises so much anxiety.
Yeah, so that concern was not unusual, and I wasn't surprised by it. And so the first time I came across the idea of psychology was in high school. It was, I think, grade 9, grade 10. And it was actually a conversation that I had with a friend of mine at the time who was wanting to become a psychologist. And that's when it hit my head. I was just like, I wonder what this is, right? And the little bit that I began to know about it piqued my interest insofar as that psychology was therefore going to become my plan B, right?
Yeah.
So that is, if this film thing doesn't work out, you know, I have something to do that's aligned with my interests, that's aligned with my values. A lot of because of the reasons that you are speaking about it as well. You know, it aligned with your values for being able to connect with people, to speak with them, to listen, to help in as best a way as you can. So that's similar. And also from a faith position as well. And the relationship for me, the relationship between my faith and my work has taken a long time to understand how it fits. There's a whole story about that during my master's. But yeah, it was not my plan A. I was not planning to be a psychologist at my age. By now, I had hope that I would have transitioned into a different world,
In
you know,
a
making
huge
films, sustaining myself,
screenwriter,
writing
screen
books.
director.
Didn't happen, right? So how could I have gotten to a place where I feel as comfortable and as not where I feel like I am where I need to be? How that happened is a journey on its own, right?
Yeah.
But increasingly, as time went on, I increasingly began to realize this is it. This is me.
I'm in the right place.
Supposed to be doing
this happened for a reason.
Yeah.
Yeah.
That sort of thing.
Wow.
Yeah. So
it's so interesting how
that's
we
its
both
own
landed
story.
in the same place. Yeah.
Exactly.
You took a more winding route. I took a more direct route, but we still got to the same place.
But that's also a reflection of our personalities. You know how I am. You know, I don't just
take forever.
Forever.
Like, just say what you mean.
Whereas you just say what you mean. Just do it. You know. But yeah, I think we both wound up at the right place, doing the right thing that's in line with who we deeply are.
Yeah, right? Definitely.
Yeah. So
it's a journey. It's actually quite interesting because I often think about whenever I'm in I'm in the journey with the clients, because obviously they come for multiple sessions. As they grow and they become self-aware and they learn more about themselves and they become so insightful, I'm on the journey with them and I grow with them, you know.
Yeah.
And it's just like, wow, this is so powerful. You
Yeah.
know, so just it's like your own personal journey, personal journey that you've been on towards psychology continues when you're sitting with your clients and practicing your job, because it's not, I'm just helping this person, they're growing. It's through me helping them, they're helping me back and I'm growing. I'm learning from them, you know, to be a better me, you know, so it's quite interesting. That whole, a little continua, the struggle continues, but in this case, the journey continues.
Yeah, you know, and I think that's a whole other conversation that I think is very important about like where we were at the beginning. And like for me, I know that, again, another conversation, but like past a certain amount of time, I began to notice how doing this work was changing, kind of put it, ideally, you know, you separate your work from your life, right? And these are ideally kind of two different universes. And I think for other people, it's easier to do because you are doing something that's different from your personality. I don't know, like if I was an accountant, right? That's what I do. And then I'm able to separate it from myself significantly.
Yeah, definitely. There's a very clear distinction. There's a clear line. Yeah.
Yeah. And in psychology, it's the same thing applies. You have to be a professional. You have to be all of that kind of stuff. And I can do that. You can do that. But as far as the kind of work that you do, you're listening to people, you are affecting them and they are affecting you, and how you process, at least for me, how I have processed my own beliefs and my perspectives has been affected by the work that I do. And not in a negative way, but it's always forced me to look at them at a deeper level. And it's changed some of the, I think for me, some of the more hardline positions that I had before when I was younger about certain things. I realized it's a lot more complicated than it looks.
Yes, you begin to realize that the world is not as black and white as we've always assumed. I think that's the interesting part of our work, is that it challenges our beliefs about what we think we know. And then we realize, oh, I thought I knew this, but no. I need to go back on this and just research some more. Yeah, definitely.
So
I think that's we've been having quite a long conversation.
Yeah, so I'm gonna round up. Let's say there's a thought that I have that I feel like is a nice full stop, right? This is something that I always say. I always say to master students, and it's this. You know, the difference between our work and the work of most other professions is that other professions largely are able to do their work using instruments or tools that are outside of themselves, right?
Yeah.
So the typical example that I might use might be, you have a doctor. They have their machines and their equipment. They have their stethoscopes.
Definitely.
They have all of the
Yeah.
stuff that they use to try and help heal people's bodies, right?
Yes.
I mean, there's similarities. They have to bring their experience and their judgment to bear on a situation, but
Yep.
it's easier to do that externalizing, right? But with us, it's very different. We do have tools, it's not like we don't. We have tests, we have
Yes.
assessments, we have this and that.
Yes.
And again, whole other conversation. But we have that. But primarily, our tools is us.
Yeah.
We bring
You are the tool.
our
Yeah.
learning. Yeah. So definitely we are trained, first of all. We're not just out there talking to people. Rest assured, we are trained. Okay.
Yes.
We are trained.
We know what we're doing.
Yeah. So when you're having a conversation with a psychologist, you're not having a regular conversation. You're having a conversation or conversations for a purpose. So we are trained. We are experienced. We're bringing that training, that experience to a third part, which is us. And all of those three things have to happen at the same time in order for, I feel, for a psychologist to be effective.
Yeah.
You have to bring your training and with your experience and then yourself. You have to bring you to the situation, And so that's the thing that I like to say to master students is like, you need to understand that about this work. It asks you for pieces of yourself,
You are the
and
tool.
you have
And
to
it sounds strange.
Yeah.
It sounds strange to say that.
Yeah. So so I think that's probably a good point to kind of wrap up for today. What is psychology? What are the psychologists? Us, and something I think I'm hoping as you're watching, you're having a bit of an understanding of just the broad field in general, but also what it's like to listen to psychologists talk about what they do and why they do it, and something of what it does to them, and it isn't bad, but it can be very challenging, and it's so rewarding,
Definitely.
And then when you watch yourself evolve and change as well, it's interesting. You're just like, oh, okay. And I didn't see that like that, but after having these conversations with this person, I feel like I'm understanding that differently. Okay.
It forces you to kind of like have a way more broader view of people and the things that they do and the reasons why they do them. So your knowledge of people just grows and grows. You don't always have like these narrow ideas anymore. So it really teaches you more compassion. I feel it makes you more compassionate.
It's made it harder for me to box people.
Yeah.
It's made it harder and harder for me to put a person in a box. It's like the barriers of the boxes are becoming more and more porous the longer I do this. There's boxes there, of course, there's always, but the boundaries are just like, it's like I can't hold the water in the box. It just keeps leaking out into other boxes. Anyway, all right. So I think that's us for today, right?
Yeah, thanks everybody for tuning in.
Yeah.
I hope you come back next week.
Please, and because we're hoping we want to make this at the very least, I think a once a week affair, bring different topics, different ideas on the table, speaking about those. And this is the reason why I want it to be a collaborative thing, because I could be speaking to a camera, this wouldn't have happened, And I think now you see it, So
that's the beauty of conversation.
Exactly. So I think that's it for today. Thank you for joining us. If you're listening only, or if you're watching as well, thank you. You didn't have to come here. You did. We appreciate it. And then, please subscribe to the channel. And I think it's useful. I look forward to hearing from you. It isn't just comments for the sake of it. Say what you want. ask us questions, and then we'll try to make that content a part of what it is that we speak about. Yeah, so Ronelle, are we good? Okay, bye-bye. I'm gonna see if I can end this recording. All right, cool, bye-bye.